partnership, ownership. Three simple words that can make a world of difference to the way that we see, in truth, to the very fact that we see. War. Who is the enemy? The enemy is blindness. Partnership. Who are the partners? The partners are all those that want to join the army to reduce blindness and restore sight. Ownership. Why ownership? Because we need the soldiers who work on the front line of eye care to own the battle and the victory. War, partnership, ownership. Emotive words, but with 20 million blind people because they cannot reach and afford eye surgery, we need emotion. Emotion that will lead to action.
In central India, in the city of Hyderabad, there's an institute that's in the vanguard of this global mission, the L.V. Prasad Eye Institute. Established with the support of the Indo-American Eye Care Society in 1987, LVP has grown into a comprehensive eye care facility and academic center that serves more than 600 patients and performs 70 surgeries each working day.
Our single-minded determination was to create an institution that will play a leadership role in this combat against global blindness, and to also have an impact both directly through the services to the local communities as well as indirectly through the training of eye care personnel from different parts of the world. The inspiration for the creation of the institute came from my exposure to the quality of eye care in the American institutions. My dream was to make that kind of care available to all Indians, irrespective of their socio-economic status, at their doorstep. I think every medical doctor should spend some time in the rural areas. It gives you a completely different perspective on the country's needs. I feel privileged that I grew up in a village and had that exposure.
From a humble village upbringing, Nageshwar Rao, or Nag Rao as he is now popularly known, was destined to forge for himself a brilliant career in the United States as an academic ophthalmologist.
I had a fantastic career there, academic dream career for any ophthalmologist in America. I had a very good clinical practice, publishing extensively, traveling all over the world, lecturing. And so with that kind of thing, you often think, do you really want to go back to India? Because everybody would tell you you won't have the opportunities to pursue what all you've been doing in the past 12 years. So where do you want to go back? It is paradoxical in a way. People think if you go to America, you never come back. But in our case, our living there has actually inspired us to come back and do something here.
My father, L.V. Prasad, from a very modest beginning, became a legendary director and producer. He made many successful films, and the revenue generated from the films were given to the charitable trust which was formed by him with the intention to serve the poor. One of his films, Ek Duje Ke Liye, brought in substantial revenue for the trust, and we were looking for a project to support. In that connection, I was in US in 1985, and one of our family friend has suggested the name of Dr. Rao, who was planning to return to India to serve our own people.
As a filmmaker, L.V. Prasad felt it was absolutely right that his charitable trust should support a project dedicated to the enhancement of vision. Not only did he donate his fund, he also offered 5 acres of land in Banjara Hills, a prime location. Together with funds Nag Rao had already raised in America, with help from his friend Professor Brijen Gupta, he was at last truly on his way.
I suppose there was a bit of sadness, definitely, because we have had a great life in America. But there was also this immense sense of excitement at the prospect of doing something so very different in India. From the beginning, I was determined that it would not look or feel anything like a hospital. It had to be a sunny and pleasant place. I was very sure we would have wide, spacious corridors, not passages where you keep bumping into others or some pieces of furniture. At our institute, it is the patient who is king. His dignity, needs, and comforts supersede everything else, regardless of whether he pays or is treated free of cost.
For those privileged to expect the very best in comfort and ambience, the Institute offers luxurious suites with every convenience. The clinical services cover the entire gamut of eye care, including the most sophisticated surgeries and treatments.
How do you reconcile excellence with equity? Quite often we say excellence is expensive, so it cannot be given to poor people. But our emphasis has been everybody who is treated here, and half of them are treated free, absolutely free, shall get the same quality care as the one who pays the most money. Initially, much of the support came from close friends and family. Over the years, the donor base has become much broader to include many international organizations from around the world, as well as individual philanthropists. Bausch & Lomb of the United States, Sightsavers International of the United Kingdom, Christopher Blinder Mission of Germany, and Institute for Eye Research in Australia are some of our major partners. Among the individuals, Subbarao Makineni, a well-known Indian-American philanthropist of Los Angeles, Sudhakar and Srikant Ravi of Silicon Valley fame, Rataya Jasti of California, and pharmaceutical tycoon Dr. Reddy are the prominent ones.
The Institute is now one of the most sought-after centers for clinical research in the world, where clinical practice draws from and feeds back into research.
When I came over here, I sort of understood that the talent in India just needed to be put together with the opportunity, and we would be able to do fantastic things. So this centre, LV Prasad, started to build a clinical research reputation based upon the excellence of the output. And at that time, the US industry was funding a lot of research in my establishment, and so I said to a couple of these companies, well, we should do some of these studies in India because we can do very large studies, very high quality, and the cost is very reasonable.
The Institute's donors cut across all frontiers. It was a pearl merchant from Japan who helped establish the microbiology laboratory.
Work in genetics, the tempo is really increasing in LV Prasad, and with the unveiling of genome, there's a lot to do. I said, let me be involved with this. There's going to be very interesting work that will go on there. After all, as a scientist, that is what I would like to see. I mean, whether it is through the funding of my company or for myself, I would like to see excellent scientific work being done with a particular goal. The stem cell research, for example, had given sight to at least 150 people at the last count. What else you would desire from science?
It has been possible for us to harvest what are called stem cells from a good eye of the patient, culture them on a membrane to produce a transparent tissue, which is in fact the corneal equivalent. Then the surgeon takes this tissue, cleans up the eye, prepares it ready for the transplant, and puts it over there. This is cutting-edge technology, and ours happens to be the largest ever human trial of this technology anywhere.
The Children's Eye Care Centre is the first such dedicated facility in the developing world, and it's equipped to deal with the entire range of eye problems in children. Cure and prevention of eye diseases form the main focus of the Institute. But just as important is the management of vision loss that cannot be cured. Here at the Rehab Centre, those with low vision and blindness are trained to build new lives.
Keep the document inside. Enough. Just open the Kujul software.
Corneal blindness is one of the most serious forms of blindness in India, but it can be cured through transplantation with a healthy donor cornea. The Raman International Eye Bank is one of the most advanced such facilities in the world, harvesting, storing and transporting corneas using methods that meet the most stringent international standards.
LVP is one of the WHO collaborating centers in the field of the prevention of blindness. We have several collaborating centers. We have actually a network of 20 collaborating centers that are all by definition of very high standard. However, I must say that LVP stands very high on this list, especially because of the quality of the staff working here and because of the excellent track record that we have in our collaboration and the contribution that LVP is providing not only in India or for India but at the global level is extremely important for the WHO.
A vital part of the LVP mission is training. The Institute is now a WHO collaborating centre for training and a major resource centre for Vision 2020, the Global Right to Sight initiative. At its Kismatpur campus, where the Bosch and Lom School is located, the Institute offers full-fledged courses in optometry and vision techniques. The Institute's International Centre for the Advancement of Rural Eye Care for short, has been set up to bring eye health to remote rural areas. Eye Care's mandate is to develop simple yet effective systems of eye care delivery to out-of-the-way places in developing countries of the world.
We've actually been working in India for around 30 years, and we've been seeking over that time good partners with whom we can work to deliver our services. So we were delighted when the LVP Prasad Institute was founded because the vision and ideals of the organisation are absolutely identical to our own, and that is to make sure that these services are provided to everybody of the highest quality at low cost or free if necessary to the poorest people in the rural areas.
LV Prasad with the eye care program is an ideal partner for us because all the components of Vision 2020 are there. And in the meantime, eye care is not only a model for India, it is as well a model for all other countries where these type of services are needed.
So now built the most outstanding, the now best recognised research, clinical, educational vision care delivery centre in the whole world. And I was just talking to some of my colleagues at WHO the other day, and this is recognised as the best institute in the world.
Stories of institutions like the LVP do not really have an end. Phases begin and conclude. People come and go, and leadership inevitably changes hands.
The vision and role of LV Prasad Eye Institute must continue. Changes in lifestyle, changes in science will throw up new problems as well as new opportunities. Our leadership role in tackling these problems will grow, and we look forward to the continued support of our partners and collaborators in our endeavor.
Meanwhile, Nagarao's work at the Institute has now propelled him to a global platform. As President-elect of the International Agency for the Prevention of Blindness, he will lead the battle to eradicate avoidable blindness across the globe by the year 2020. And actively supporting him in this vital endeavor will be the institute he founded and nurtured. The institute that has opened the eyes of thousands of people, one by one, to a world full of possibility.